As we move from issues and key barriers to digital health, it's important to then next consider what are the key technologies and implementations of digital health. One of the biggest changes I think we'll see is the role of AI and machine learning in digital health. We will be, as we talk about in later slides, really changing the delivery of healthcare, I believe, in this country and in the world based on AI and machine learning. We'll also see biotech and telemedicine take on more prominent roles in the healthcare system. IoT, Internet of Things, will be also really changing a variety of different, probably diagnostic as well as treatment options for many patients, and big data tying into AI and machine learning. We'll see those issues really, I think, come to the fore in the next few years. As part of that, also, we'll look at wearables and medical devices. How are those going to interact? How are they the same? How are they different? How your phone will interact with those devices, as well as feed data back to clinicians. And then, as part of the change, and again, really in how we treat people, we'll see nanotech and robotics and genetics and personalized medicine really change many of the treatment options, I suspect, in the next several years. There are a number of key questions that we need to ask to try to anticipate some of the issues we'll deal with digital health and hopefully come to better outcomes. One of the first questions is, what does an e-hospital look like? Will the role of hospitals change? I suspect it will. We'll probably use hospitals less in some ways if we can get better data from someone while they're not in a hospital. Treatment and delivery of treatment likely will change as well, and so it may be that we need hospitals less for clinical interventions than we do now. The hospital, though, may be much more embedded with technology than we've ever seen. There may be fewer machines that do more things. There might be more machines, we don't know, but we do know that the hospital of the future will not look like the one of today in many ways. Another question is, how do we deliver digital health in the most effective way? That's in terms of cost, which obviously is a key driver of digital health, but also in terms of efficiency for the clinician and the patient. If I can get treatment in my home remotely, that's easier for the clinician, it's easier for me. And we've got to start thinking about how do we use digital health really to deliver care in the most efficient and diagnoses in the most efficient way. Blockchain plays a key role in things like cryptocurrency. It also can play a key role in other forms of technology such as digital health. We don't know the contours yet of what blockchain's impact will be on digital health, other than to know I'm sure it will have some impact, and we've got to figure out what the best way is to incorporate blockchain into our digital health offerings going forward. A key issue that really marries up a lot of AI and machine learning to better healthcare outcomes is, how do we use predictive analytics to impact behavioral change? And so what we're really saying there is, how do we take all the learnings we'll have and then get patients to make behavioral changes to improve their healthcare outcome? We don't know all of the steps in that process yet, other than that is one of the key things that digital health is looking at trying to solve. Related to that is, can machine learning help better manage chronic diseases? We hope the answer is yes, but we've got to figure out what that path is and what the best way is for patients to better manage these chronic diseases through using machine learning and AI. One of the key issues we'll have to deal with before we get to that point, though, is what are the limits, whether they're legal, contractual, or other, on the implementation of machine learning and AI? Many states have restrictions on the corporate practice of medicine. How is AI going to play into that and machine learning? Is it not an issue at all? Is it a bigger issue? And what's the role of humans once we have AI and machine learning really looking at some of these issues and making diagnoses? And that really tees up the last question on this slide, which is, what role will humans have in treatment and diagnosis? Will we get to a point where a human is almost an appendage to the process? Will we still be using humans to back check AI and digital health solutions? I don't think we know fully the answer of how this will play out yet, other than the role of humans will necessarily be reduced as we use more and more technology.